Okay, we're live. Hello, it's Bill, the Knee Pain Guru, and welcome to this week's edition of the Ask Dr. Beck show. Welcome, Dr. Beck. You are not at home. Where are you at?
I'm not at home. I'm in New Orleans.
New Orleans. And you're
Yes.
you're teaching or lecturing to whom?
The sacro-occipital technique chiropractors.
Sacro-occipital. Is that how is that similar or different to the Atlas orthogonal chiropractors?
Oh, the Atlas orthogonal just do the Atlas.
That's it. Okay, so these guys.
That's it. These guys basically it's the chiropractic version of cranial.
The Atlas orthogonals.
No. The folks that I'm teaching.
Oh,
yeah.
The craniosacral chiropractors. Got it. Okay.
Yep.
Well,
and
cool.
a really great group of people. Yeah.
Awesome. Well, good deal. How long you down there for? When you back at the ranch?
We are going home on Saturday. What is today? Friday. So tomorrow. Yeah.
Okay. Cool. And the last week you were in California.
Oh no, this week.
This week.
Yes, early this week.
Oh, got it. So you
flew on Friday, taught in California Saturday, Sunday, came back on Monday, had a day home, left on Wednesday for New Orleans.
Got it. And all of these classes that you teach can be found on your website, osteopathicvision.com.
Some of them, yes. I'm just giving a lecture today, so it's not technically a class. But yes, all the classes can be found on osteopathic or osteopathiccourses.com.
Oh, osteopathiccourses.com. Okay.
Yes.
Well, we have this one, Osteopathic Vision.
Okay.
And let's see. Ethic courses.com. How about that?
Perfect.
Okay. So they can check out more information on what you're doing, where you're going to be, where you're premiering. Okay. Let's see. Questions this week. This is a partial tear of the anterior talofibular ligament. How about that one?
Okay.
Okay. This is from I'm gonna butcher this name, Gunj, Dhedia, and this is from our YouTube channel. It says, "Hello, Dr. Beck. Severely twisted my left ankle playing soccer. MRI scan shows the following: high-grade partial tear of the anterior talofibular ligament, as well as the calcaneofibular ligament. Low-grade partial tear of the posterior talofibular ligament. Minimal amount of edema in the medial aspect of the proximal talus related to the prior inversion injury.
Yep.
No acute fracture. I had a left ACL complete rupture surgery in May of 2019. I've been playing a little since then. I have regained full leg extension, but I do feel the stretch every now and then, which makes me wonder if surgery is a good option. I want to get back to playing soccer and other physically intense physical activities. Is surgery the best way, or extensive PT would heal the ligaments?"
Neither.
Yeah, I was going to say C.
Yes. Yeah, the answer is definitely C. All right. So it's a simple answer, but with the explanation, the answer becomes complicated. Would you pull up for me on Dr. Google Images an image of the ligaments of the ankle?
Okay. Do that. Share my screen. Okay, images. Are you able to see the images?
How about the colored one on the right top row? The one that kind of shows the skin as well.
This one?
That one, yep.
Are you able to see that now?
Yep. That's perfect. That's perfect. Okay. So our ligaments there are in yellow.
Okay.
And there are 2 ligaments at the top and 3 ligaments at the bottom. So the one that's closest to the toes, that would be on the right side of the screen. If that tears or gets stretched, you have a grade 1 or a 1st-degree sprain.
Mm-hmm.
The first one, the one toward the toes, and the one that's almost straight up and down, if those 2 are involved, but not the last one, then you have a 2nd degree or a grade 2 sprain. Mm-hmm. If all 3 are involved, it's a 3rd degree or a grade 3 sprain. So we have, from the description, a grade 3, all the ligaments are affected.
Okay.
Now, that's all fine and good. So, and we have ligaments that have partial tears in them. So basically, if you look at those 3 bottom yellow objects, they're mangled, right? That's the thing to remember. But we haven't looked at what happens mechanically when the ankle sprains. So the bone in the back is called the calcaneus. That's the heel bone. And you can see that the heel bone comes up to just a little bit more than halfway in our picture. And then on the bottom, there's another bone in front of that bone. That bone's called the cuboid. Okay, so it's on the right-hand side of the screen, but it's not all the way across. Right?
Okay.
See that? And you put your pointer over it so the people know what we're talking about?
Are you able to see my pointer?
No.
Hold on a second. Am I able to? Whoop. Nope. How about now? You able to see it that way?
No.
Okay.
I can put my pointer over it, but it's not going to do you any good.
I get you. Okay. I got my mouse over the top of it.
I can see. I saw your pointer when it was above. Yes. Okay. Right. You got it. I see it now. So that bone is called the cuboid bone. And in Latin, it's named cuboid because it is cube in shape. So think ice cube, right? That's the gist of it.
Got it.
That bone is the keystone for the lateral, the outside load-bearing arch. So we have to understand what happens in an ankle sprain to understand why surgery is not the best option, nor is PT.
Mm-hmm.
In order to have an ankle sprain, there are a couple of things that must happen. Either, and let me see if I can do this so you can see it. Okay, this is the bone called the talus. This is the ankle bone.
Okay.
And over the top of the talus, we have something. Let me see if I turn it right. We got something on this side, and we got something on that side, right? These are the malleoli. So we've got one on the inside, one on the outside. They make a kind of joint called a mortise and tenon. I'm going to turn it this way so that you can see it. Basically, these things on the outside lock the talus so the talus can't twist. Mm-hmm. If these things weren't there, the talus could move. And if the talus does this, that's an ankle sprain. Mm-hmm. So in order to get an ankle sprain, one of 3 things must happen. We break one side, of my thumb side. If we break that, the ankle can sprain. If we break this, the ankle can sprain. Or we have to spread those bones apart for that talus to be able to move. Okay? It's the spreading apart that this patient is describing. Okay? And so now here's what happens in sequence. The the talus, the bone we've been talking about, rotates just a little bit. The top of it, the part toward the top of the foot, goes toward the big toe side of the foot, and it falls down. Okay? When it falls down, the bone that's attached to it, called the third cuneiform, rotates toward the outside of the foot, the little toe side, because they're connected. That rotation takes away the outside stability of the talus.
Okay.
And the talus begins to move. It rotates. Okay. So there's this cascade of events that happen. And as that talus rotates, what you'll notice is that when all those bones start to move, there are ligaments that attach the fibula to the foot. So as the foot starts to do this inversion sprain, it drags the fibula down toward the bottom of the foot. Okay. When the fibula moves, the fibula is attached to the tibia via this big wide rubber band, which is called the interosseous membrane. And the way the fibers work in that interosseous membrane, when that fibula comes down toward the bottom of the foot, the tibia and fibula get more space in between them. When they get more space in between them, now they can't lock the talus, the ankle bone, in place.
Okay.
And so it's a big cascade of events. But basically what happens is when your ankle rolls to the inside, it does that because the bones of the actual foot have moved. And as those bones of the foot move, they destabilize the ankle bone. The ankle bone moves. And when the ankle bone moves, the bones of the lower leg change their relationship to each other. Okay. Now, if you have not had this treated by someone who understands all of this, it is going to stay that way. Okay. And so this is why the orthopedic surgeons, they're going to go in and repair those 3 ligaments, thinking they've done a great job. And what they will tell you is you're probably always going to be predisposed to having ankle sprains. Because, and this is not no knock against orthopedic surgeons, they're fabulous, but they didn't understand the mechanics of what happened. And so they, without understanding the mechanics, they don't fix the whole problem. Okay. Same with physical therapists. They don't get taught the way that we do. So they're going to try to strengthen something that is not really the thing that needs to be strengthened in that moment. Okay. So what you have to do in treating this ankle sprain is basically reverse the events that happened in creating it, and you treat them in that order. You have to fix the ankle bone, the talus first, because if it's not fixed, it gets in the way of everything else being corrected. Then you have to fix the third cuneiform. Then you have to fix the cuboid, and you have to stabilize that whole assembly. And then you fix the interosseous membrane, move the fibula, that outside bone, back up toward the head. And now what I've done is I've fixed the mechanical aspect of the ankle sprain. But I still haven't fixed the ligaments.
Right.
So I need to do that. And then I can do prolotherapy and get those ligaments to repair themselves. Then I've got a stable ankle again. And unfortunately, the physical therapists don't understand that part. They can't do prolotherapy. So that's not in their brains as a possible treatment.
Right.
The orthopedic surgeons, I'm going to say probably 99.9% of them, don't do manipulation. So they aren't going to look at it from the mechanical aspect. They're just going to see what happens on the MRI, and they're going to fix the things that are off on the MRI. But keep in mind that, which would be the ligaments.
The torn ligaments, right.
The torn ligaments, right. They're not going to look at the interosseous membrane, and because with our current technology, we're not seeing function. We're taking a picture, just like this image that you're showing us is a picture. the image doesn't show us anything about how the foot actually works.
Right.
And so we're not going to know if all the parts are working perfectly, or if even one tiny thing is out by just a picture.
Right.
We've got to use hands currently because there's really not any image that will show us that.
Mm-hmm.
So that's the complicated answer to the simple question of, can the orthopedic surgeons fix it? Well, they can do their surgery, but it isn't going to fix the underlying problem. Can the physical therapist fix it? No. They don't have the scope of licensure to do what I could do.
Or the skill set.
There may be some out there with a really good skill set, but like, for example, if they can't do prolotherapy, then how are they going to get those ligaments to completely heal?
Right. That was cool. We've gone over this, I think, last year. I think there was something that we talked about ankle stuff, and we went over this collapsing of essentially the arch, the whole integrity of the foot collapses, and then the foot is way more, or the ankle is way more prone to the sprains. And if I remember correctly, I turned my ankle like the following week after we talked about it. So I'm going to pay attention this week.
Yep.
It's good. Okay. Let's see. I think we have another question. Let me double check here. Okay, this is where, so Gunj, Dhedia, if that didn't cover your question, please write in and let us know again. Let me see, we got lower back pain question here from Lisa. It says, have had lower back pain on and off for years. Has gotten worse since aging, and my job has me sitting all day at a computer. Not sure if it's sciatica or what. Never went to the doctor or a chiropractor. Tried stretches and exercises for my core, lower back and hips. Motrin stopped working, so I happened to stumble across your video and was immediately tried it with laying on the floor and calves on the couch. Was very skeptical, but I figured what the hell. It helped about 75% just that first time. I will continue this a few times a day, and we'll let you know how it goes. So that was a good one. And that's all we got. That's everything.
Awesome.
So, anything else you'd like to share? Oh, for those that are online watching, you're welcome to submit your comments, questions, whatever you have. And if you're watching the replay, feel free to type in your questions in the comments section, and we will get those on future Dr. Beck, Ask Dr. Beck episodes.
So there is one thing that I want to share. And so forgive me if this is like concept for me, and I'm trying to figure out how to get the words correct so that it conveys the right meaning.
Okay.
And so when we look at something, and this is anything that we look at, and it doesn't work, right? So I'm going to give you an example. I have nut and bolt. I am trying to pull the nut off of the bolt, and it isn't moving. Okay. So my brain can immediately go to, make up some expletive. This thing is never going to work. And I basically can shoot myself down from the beginning.
Mm-hmm.
So this is, if we're dealing with pain, whatever I've tried doesn't work.
Mhm.
So therefore, I'm going to be left with the pain forever. Okay.
Right.
Or I can go back to looking at the nut and bolt and say, what is it about this particular issue that I don't understand? Now, it's either because I don't know about it, or even if I know about it, my brain never has been able to make sense of it.
Mhm.
Okay. So, for example, if the nut was rusted onto the bolt, I now understand my problem a little differently. I understand why there may be difficulty, and I may need something to dissolve the rust. If the bolt head is rounded, I may need something that grabs it in a different way than a regular socket wrench.
Mhm.
Okay. So if we go back to the body and pain, if I have pain and I have tried something, doesn't matter what it is, and the something didn't work, then I either have the wrong diagnosis. So I'm not looking at whatever the problem is from the right angle,
Mhm.
or I have the wrong treatment, or both.
Mhm.
And if I try something different and something different and something different, but they're all looking from the same perspective.
Mhm.
And the perspective is, like every perspective is, flawed because we're humans, right? We're going to see some things, and each of us is going to be blind to some things. Thank goodness we're not all usually blind to the same things.
Mhm.
So if I find someone that thinks differently about my issue, my pain, then I'm going to be able to hopefully find at least one avenue that will release it. And that's the important thing to remember. In medicine, we're kind of taught that because you're of the 1% of the intellectuals, right? You made it through pre-med, you made it through medical school, you made it through residency. All these things require a lot of brain function. That no one thinks differently than you or above you, and we could say that that becomes a God complex,
Mhm.
right? So therefore, if I don't know it, no one else can know it,
Mhm.
which is a falsehood, of course, because again, we're all human. So the thing to remember in our ankle question, the thing to remember about low back pain is
Mhm.
that if you're seeking help and the people that you are seeking help from aren't helping your condition, find someone who thinks differently about your condition and give that a try.
Mhm.
And if that doesn't work, find someone who thinks differently still and give that a try.
Mhm.
That's it.
Yeah. I mean, you could apply that anywhere in life.
Anywhere in life, absolutely.
I mean, it's like I consider myself relatively bright and intelligent and all that kind of stuff, and
Right.
there are some things that my like absolute gems that my daughter will drop, and
Yep.
I gotta stop for a moment and be like, "That's a pretty good idea."
Yep. She is smart in a different way than you are.
Right. Yeah. And I've tried to whenever she says anything, she's not saying it flippantly. She's saying it
Correct.
because she's observing something. She's seeing something that I'm not.
Yep.
And if I'm able to get my ego out of the way and listen to what she's saying and go, "Huh, yeah, I think it's a pretty neat idea."
Yeah.
I got a story if you want to hear it.
Sure.
She had these stamps, like these she must have been 3 or 4. And she had these rubber stamps
Yep.
um, where she would get ink on it and she would
Yep.
stamp her papers.
Okay.
And she had this one really big coloring book that had on the inside cover there was it was blank. And my job when she left to go back to her mom's was for me to make a map for her. So I took these stamps and I put it all over there. And then I drew like this little path, like you would see.
Sure. Yep.
Through the forest or whatever it was. And I had this really long, elaborate thing. And she comes back and she goes, Dad, why didn't you just go here? And, you know, she like does it, one of these cutting the big, long turn off of it. And it was like, okay, I got it. That made sense. But it also was very reflective of my life at the time.
Right. Yeah, absolutely.
Anyways, so that's where what we got. No, that's awesome. That's awesome.
Yeah.
I think that's a great perspective to have when people are stuck, when they're struggling with pain. They shut down options, and in actuality, sometimes it's best to open up for more options to get a solution coming from an area that you wouldn't even think of.
Mm-hmm.
So awesome. Well, I think we'll wrap it up for today.
All right, brother. Sounds good.
Thank you so much. We're going to wrap up today's Ask Dr. Beck show. This is Bill Paravano, the knee pain guru. Thank you all so much for being here. Have a wonderful day, and we will see you on next week's episode.
Thanks, everyone.